Test mic, test mic.
Test, test.
Apa dia punya ni? Okay. Yes.
Test. Good morning and welcome to the judges, teachers, guests, and participants of FRSIS 2022. Now, I would like to introduce our judges today. The Chief Judge is Dr. Dalila binti Roslan, Public Health Medicine Specialist. The second judge is Mr. Muhammad Farhan bin Adnan from Sekolah Menengah Sains Hulu Terengganu. The third judge is Ms. Halaina binti Gapo from Sekolah Menengah Sains Banting. And I, Nur Ayuni Kristina binti Rosdi from SBP Integrasi Gopeng, while the timekeepers Muhammad Afiq bin Azmi and Muhammad Arif Firdaus bin Khairul Anwar are from Sekolah Dato' Abdul Razak. Now, allow me to read the rules. Each team should consist of presenters and a technical assistant. The presentation must focus on the sub-team assigned to the team. The duration of the presentation should not be more than 10 minutes. The bell will be rung once at the 9th minute and twice at the 10th minute. A question and answer session will be conducted after each presentation. Now, I would like to invite Sekolah Menengah Sains TU to present. The floor is yours.
Now, ladies and gentlemen, before the pandemic began, I want to ask you something. Have you ever wondered of a sudden emergence of a disease that would change your life 360 degrees, which in fact has caused more than 200 million of people worldwide to lose their job? Or have you ever imagined that Singapore's richest oil tycoon, Mr. Lim Un Queen, would actually file bankruptcy in just a few months after the pandemic began? Or have you ever thought of how would our government handle this pandemic to all 36 million of Malaysians, regardless of our races, religions, and our background? Well, that is why we are here today. But before that,
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. I bid to the genius and esteemed educators, beautiful moderator, and thank you for our spectators for being with us today. Now, we have done our own mini research on vaccine equity across the globe, and now we shall present to you our subtopic, which is vaccine equity, global acceptance, and prejudices. My name is Muhammad Tajul Arif bin Muhammad Tajul Aslan, and I will be your presenter for today.
And me, Nur Azmina Batrisha binti Zulkifli, will also be your presenter for today. But not to forget, behind the screen, we have our genius technical expert, Mr. Muhammad Aida Musahim bin Muhammad Azhar. And of course, sitting over there, our Mr. Pochua, Miss Nur Alia Maisara binti Muhammad Nur. And we are the FRSIS crew representing Sekolah Menengah Sains TU.
Now, on to our definitions. How do we define vaccine equity, global acceptance, and prejudices? Well, vaccines are biological substances which provides immunity to one or several diseases through vaccination. And equity means making sure people get access to the same opportunities. Sometimes our history or differences can create barriers to participation, so we must first ensure equity before we enjoy equality. In the context of COVID-19, we'll explain later on. As for global acceptance, it is an agreement on a global coverage which represents the positive outlook of our society.
And last but not least, prejudices, which mean an unfair or unreasonable opinion or feelings, especially when are formed without enough thoughts or knowledge, majorly have caused barriers of protest across the globe. And now, ladies and gentlemen, let's take a look at the journey from pandemic to endemic in our world today. So it all started in 2019 in Wuhan, China, where the first outbreak had occurred, which has triggered the global outbreak, and next, Malaysia has begun the pandemic era. And after about 2 years of MCO, COVID-19 vaccine was invented. And with this, the help of these vaccines, we are finally right now in the endemic era, back to as it were before this all begins.
Now, do you know that vaccine itself was invented due to the deaths of millions of people in the 18th century by a disease known as smallpox? Well, that's where the history of vaccination all began in England, 1789, where Dr. Edward Jenner invented the first ever vaccine, and followed by in France, 1921, Albert Kalman invented the vaccine for tuberculosis, also known as BCG. And following that, Dr. Jonas Salk invented the vaccine for polio in Pennsylvania in 1952. For the far western side USA, Maurice Hillman invented the vaccine for measles, also known as MMR, in 1963. The Public Health Agency of Canada invented the vaccine for Ebola in 2019. And last but not least, I'm sure all of you are aware and recognize the coronavirus disease 2019, which is vaccines production started in 2020, one of which being Pfizer, made by Ülküsahin and Oslam, Turkey.
And now, ladies and gentlemen, we have the vaccine for COVID-19. The question that I would like to ask every single of audience here, what do you know about the COVID-19 vaccine equity across the globe? Well, ladies and gentlemen, globally, we have about 5.3 billion of people vaccinated, with about 12.75 billion of doses of vaccine being distributed to these people. However, ladies and gentlemen, despite the huge number, these digits alone have barely contributed to about 69.7% of total global population vaccinated, leaving behind about 30% of the global population left unvaccinated. In some of the country, on the contrary, the first country being United States of America, as you can see, have vaccinated about 68% of their citizens, and one of the richest country, which is also one of the first country to receive the early supply of vaccines, Kuwait, being slightly higher than United States of America at the rate of 78.52%.
As for lower income countries, in the African continent, in Somalia, it has reached a vaccination coverage of 25.3%. And at a more concerning rate, in Nigeria, it has reached a total amount of 17.5%. And last but not least, our beloved nation of Malaysia has reached a total amount of 85%. Evidently, it shows that Malaysians are very much competent and capable of great things. So what else for us to do if not to congratulate our citizens and, of course, our government?
And now, why are we having so much difficulties, and why are we yet to reach the total vaccination on our global population? Well, ladies and gentlemen, the first difficulties that we are facing when trying to get our citizens vaccinated are poverty. I'm pretty sure that all of you are aware that we have those poor countries, Somalia, Nigeria, Mongolia, and such in African continents, where for these citizens to merely get a food every single day is already a struggle. Therefore, getting vaccinated is simply out of question. In fact, ladies and gentlemen, the government themselves don't have the income they needed, the money they needed in order to get all the vaccines they needed to vaccinate their citizens. In richer countries, on the contrary, such as Africa, America and Kuwait, they are having troubles with prejudices and protests among their citizens, where their citizens of understanding information and knowledge on why vaccines are actually important.
Therefore, initiatives were made to solve these problems, one such being partnerships, such as the COVID-19 Vaccine Delivery Partnership, also known as COVDP, launched by WHO, UNICEF, Gavi, and other organizations. Their aim was to intensify the delivery support of vaccines to 34 low-income countries, such as Nigeria, Mongolia, and Madagascar. Another WHO in the 24th to the 30th of April. Their purpose was to encourage people to get vaccinated by showing the importance of vaccines.
Now, why are we trying so hard to vaccinate our citizens? Don't you ever wonder why? Well, here are some of the importance of vaccine. One being healthcare. I'm pretty sure that all of you are aware that that COVID-19 has taken the lives of so many people. But are you actually aware that the death due to the virus itself are about 6.57 million across the globe. Now that's a huge number, isn't it? So therefore, getting vaccinated is very important to make sure not only that the death rate decrease, but also to protect those with weaker immune system and couldn't get vaccinated, and let's create a healthier community. Goes down due to the pandemic. Therefore, getting vaccinated is very important, not only to open this business back, but to get over those 200 million people who were unemployed during the pandemic get back to work, and next, boost back the economy globally and nationally.
Now, for tourism, I'm sure some of you would love to travel, but with the pandemic underway, it is very much impossible for you to do so. But with vaccination posing as a solution, tourism and aviation companies can start operating again, and travelers can get back on track to their traveling days. As for socially, the COVID-19 pandemic has prevented people from freely communicating with one another and severed the connection between people. According to WHO, the COVID-19 pandemic has triggered a 25% increase in the prevalence of anxiety and depression worldwide. But with the existence of vaccination, people are now able to freely communicate with one another and reconnect the severed connection between people.
And now we are here together in this room in order to experience the 10th National Symposium together. And if it's not for vaccine, who else can we actually gather here together, ladies and gentlemen? And that will be the end of our presentation. But before we truly end it, we would like to give our deepest gratitude and thanks to those who actually make today's presentation possible, starting from Associate Prof. IRTS Dr. Haziza Ibrahim, a Senior Lecturer in Engineering Faculty of UNIMEM, Prof. Dr. Mazidah Putih, Rector of UITM Terengganu, Institute for Biomedical Ethics, University of Basel, Switzerland, Care and Public Health Research Institute of Maastricht University, the Netherlands, Dr. Hazinda Ibrahim, Ophthalmologist, some of the references as you can see, and all that have contributed to our research and make today's presentation possible. Thank you very much. Now, finally, ladies and gentlemen, me and my crew have you?
Now ask, don't assume, trust the facts. When it comes to vaccine decision, there is no dilemma for us because vaccines save lives and we trust the facts. And with that, thank you.
Now, I would like to invite participants to ask questions.
Hi, a very good morning. So I'm from Academy Science Pendang, and earlier you guys mentioned about the importance of social and also compared to the benefits that we can get from already existing online technologies. For example, for economies, well, there's online shopping that already addresses the problem, and for social, there's like this social media and also messaging applications, right? So how do they compare against vaccination? Thank you.
Thank you very much for the question. That's a very good question indeed. So you see, ladies and gentlemen, we have all witnessed with our eyes how much the pandemic have brought our community down. The depression rate are increasing and so many much more problems that I do not need to mention, I believe. And therefore, that is why we believe that getting vaccinated is important because we want to bring back our community back to its state once before the pandemic all began. Because I'm pretty sure that all of you here are enjoying our current situation in the endemic of era and wouldn't want to experience once again the pandemic. Sure, doesn't it? Okay. I hope that answered your question and thank you very much for the question just now. Okay, next.
Assalamualaikum warahmatullahi wabarakatuh. My name is Putra, representative from Baturake Integrated Boarding School. Great presentation. One question about the distribution of vaccine in poorer countries. We know there's difficulties in that, especially in storage, where vaccines need to be kept at a very cold temperature to make sure that these vaccines don't go bad. And do you have any plan or any suggestions so that we could make this happen with maybe lower costs that can be more efficiently distributed? Thank you.
So you want my suggestion?
Yes, thank you.
Okay, I'm pretty sure it's not a suggestion anymore because I'm pretty sure that it has actually been carried out all. So as my teammate just now have explained about COVDP, a COVID international delivery where there are Gavi, COVAX, WHO and more are actually having a partnership with each other in order to help this poorer country to distribute the vaccine to this poorer country. In fact, World Bank are actually in this, and they're actually trying to gain the money they needed to get those vaccines, to get the infrastructure and all to distribute the vaccines to these places. Okay, I hope that answered the question.
Thank you so much.
Yes.
Now, I would like to invite the judges to ask questions.
Thank you so much for a very great presentation. For my question, I'm just curious to understand better. How did you do your literature review? Do you have a certain criteria on how you choose the article or your reference when you did your study? Your research. Do you have a certain way on how you choose your literature? Thank you.
Yes, we actually do have a certain way of doing our research in which we search scholarly articles about the vaccine equity across the globe and refer to it to the World Health Organization website to validate it how well it is true.
Thank you to Sekolah Menengah Sains TU for your presentation.
Thank you very much everyone today.
Testing, testing, 1, 2, 3, 4.
So come here. You are the one who's holding the mic, right? It's utmost important for you to sustain the distance of your mouth and the mic. Oh, one tip for you, really useful, works every time. Like this. Let me show you where. That is good, right? Okay. Your dagu, your chin, right? Let's put it here.
Check, testing.
Mic check 1, 2. Bismillahirrahmanirrahim. Hello everyone. See, when my head turns, the volume is the same. It's utmost important to keep your mic to your chin. Need tips lah sikit, eh? As an MC, right? The one who's standing in front, right? Whenever you move around, you have the tendency to, the voice, volatile volume, I would say, okay? So yeah. Right? So just get comfortable with it whenever you
Like this. Okay. All right. Okay, thank you. Yeah.
Okay. So you use your left hand.
Now, I would like Now, I would like to invite Academy Science Pendang to present. The floor is yours.
Ladies and gentlemen, in 2021, there were nearly 100,000 deaths due to COVID-19 cases. And out of these 100,000 death cases, 80% of them happen to be unvaccinated people. Do you want to be a part of this 80%? I'm sure you would have said no. But unfortunately, not all people have this choice. Well, what am I trying to say here? When we talk about the global acceptance of vaccine equity, people usually relate it to the choice of the individual. But have you ever thought that economics and policies could affect it as well? Before I go on further, a very good morning I wish to the chief judges, moderators, timekeepers, ladies and gentlemen. Today, standing here, myself, Angela Francis, together with my teammates Eula, Muhammad Wafri, and also Abian, will tell you all about the economical effects on vaccine equity.
Now, before we begin our presentation today, I would like to first introduce our topic. Well, in December 2019, the COVID-19 virus was discovered in Wuhan, China, and subsequently, on the 11th of March 2020, the World Health Organization, WHO, declared the COVID-19 outbreak as a pandemic. But ladies and gentlemen, today, we have transitioned from the pandemic to the endemic. And one more thing to note, ladies and gentlemen, is that on the 2nd of December 2020, the first nation in the world, the United Kingdom, approved a vaccine developed by Pfizer and BioNTech. It was the first vaccine in the world to be approved by a nation. Now, at that time, around 1.6 million people have deceased due to COVID-19. But despite the approval of such vaccines, global deaths continue to soar, reaching over 6.5 million by today. Now, Angie, why do you think that some people don't receive these life-saving vaccines?
Well, to answer this question, first we need to define the term vaccines. So according to the Oxford Dictionary, vaccines are defined as chemicals that are injected into the blood to guard against sicknesses. Thus, vaccine equity is defined as a situation where everyone is given the opportunity to get vaccinated equally. However, despite the effort done globally, as of June 2020, only 58 of the World Health Organization, WHO, 194 state members had reached 70% of their target for the COVID-19 vaccination rate. But why are we seeing this, ladies and gentlemen? Well, evidence points towards unequal vaccine distribution. See, there are many causes for unequal vaccine distribution, but today we are mainly going to be focusing on global production, global trading, and healthcare delivery.
Thank you, Angie. I do agree with you. Now that you have established the definition of vaccines and vaccine equity, as well as provided us with some key insights into these vaccinated individuals, I shall proceed with our first cause, global production. No, at the end of the year 2021, there were a total of 12 billion doses of vaccines produced worldwide. However, this is insufficient to cover a global population of 7.9 billion people, taking boosters and also secondary doses into account. Now, as you can see here, 80% of the high-income nations' populations are vaccinated, whereas less than 10% of those in low-income nations are vaccinated. Now, a great example as to why this is happening will be high-income nations purchasing 70% of the vaccine doses produced by Pfizer, leaving the remaining 30% for low-income nations to fight over.
Thank you, Eula, for clarifying to us the issues under global production. It is fairly evident how severe the inequality is between high income and low income countries' vaccine access, as well as the insufficiency of vaccine production globally. Now, let me enlighten you more about global trading, as we mentioned earlier, another cause of unequal vaccine distribution, and to what extent the issues are. So first, we would like to show you the three main problems under global trading. The first one being trading policies, which refers to government rules governing international trading. The second one being regulatory framework differences, which is defined as legal mechanisms that exist on national or international level. And the last one being complex procedures, which we deem as monotonous or excessively time-consuming processes in global trading. But why do all of these problems matter? Well, ladies and gentlemen, ever since the pandemic, the export restrictions on medical products had shot through the roof, reaching a peak of 147 in October 2021. See, it is necessary for every medical product being exported to go through drug agencies, which have many restrictions that may ultimately disapprove of the product being exported. This has resulted in precious time being taken away from distributing the vaccines.
Thank you, Angie. Now we can clearly see how these trading restrictions, they are seriously affecting the vaccine exports, and they are in dire need of some systemic reforms. Now, there's still one more aspect, and that is the delivery of healthcare. Well, when we talk about the delivery of healthcare, all vaccines have to go through drug agencies such as the FDA in order to go through quality control and regulations to ensure their competency and safety. However, current ways of testing these vaccines, they are seriously time consuming as it takes years of data to ensure the safety. No, another colossal issue in the industry will be high-income nations excessively purchasing these vaccines. Now, as you can see here, 50 million doses of such vaccines have expired, while there are 200 million doses approaching their expiry date.
Thank you, Yuda, for clarifying for us the issues under healthcare delivery. Now, with all the challenges stated, the real question is indeed whether this could all be ended. But what if I told you it could, and we came up with a solution for this? Ladies and gentlemen, if developed or high-income nations collaborated, it is highly possible that vaccine production could be boosted and streamlined delivery could finally be achieved. To get a clearer look at this, if developed or high-income nations worked jointly and collaborated, not only will the number of vaccine doses produced be boosted by sharing technology and knowledge on manufacturing, but also systemic changes could be done to organizations such as the FDA to reform quality control with the advancement of vaccine production technology and testing techniques, including artificial intelligence. With this, the delivery of vaccines to developing countries could finally be streamlined to achieve the greatest efficiency. All this while staying safe.
Thank you very much, Angie. Now, we can clearly see, like, it seems that after all, collaboration is doubtlessly important. Is there anything else you'd like to add?
Yes, actually. Alone, we can only do so little. But together, we can do much, much more. Imagine the world we could create with international collaborations.
Now that is eye-opening. Ladies and gentlemen, we have arrived at the end of our presentation today where lots of knowledge and views have been shared throughout. We have learned the gravity of the situation and the causes of it from global production, global trading, and healthcare delivery perspectives, as well as the solution to this drastic global issue that is collaboration on the international level. With that, thank you for your attention.
Here, I would like to invite audience to ask questions.
Okay. Assalamualaikum and very good. So I have a question regarding vaccine. So according to Centers for Disease Control and Prevention, about 60,000 of reports received due to death by COVID-19 vaccines. What are your opinions on this death? Can you repeat? So you see, according to Centers for Disease Control and Prevention, there are about 16,000, more than 16,000 of death due to COVID-19 vaccines. So what are your opinions on these people's death?
Well, as Angie mentioned just now in the solution, we could do these systemic changes to organizations such as FDA and perhaps also World Health Organization to, how do you say it? Like to make the testing technologies more advanced. And one thing she pointed out is artificial intelligence. Well, artificial intelligence can basically learn from data that we can collect from various sources, such as like previously like vaccines that are known to be defective, and from that it can learn to identify what causes these defects and which things are dangerous. So from this point of view, we can actually solve this issue. And then one thing I also like to point out is that artificial intelligence is actually quite fast with the resources, and of course you need the good training data. But I believe that is a good investment for organizations to invest in. Yes, sir.
Assalamualaikum warahmatullahi wabarakatuh. Again, representative from Bataraki Integrated Boarding School. Great presentation, love it. One question about the boosted production of vaccine. We all know the risk, like the question I asked before, that there could be risk of side effects due to the vaccine. And my question is, with the boosted production of vaccines are being produced faster and faster. Is there a risk of those vaccines being not as effective as vaccine that takes longer amount of time, or is there a risk of a larger side effect for boosted production? Thank you.
So, as Eula just said just now, with the advancement of technology, our solution, we are trying to ensure the best safety of the vaccine. So therefore, we can actually reduce the side effects. Does that answer your question, sir?
Next, I would like to invite the judges to ask questions.
Okay, good day. A very interesting and eye-opening presentation. My question to you is, in light of the revelations that you have just presented to us, do you think that there will be an overproduction problems of the vaccines? The overproduction problems of vaccines.
Well, just now our data have already pointed out like the amount of doses is already insufficient, right? So we clearly need more of them. So I don't think overproduction will be an issue because essentially factories can just reduce the amount of vaccines they produce once it is adequate and enough for the world.
Thank you to Academy Science Pendang for the presentation.
Thank you.
Thank you.
This session will take a break for 5 minutes for technical transition.
Turun.
Testing, testing. Testing, test, test, test. Test. Testing. Like mic 1, 2.
Now, I would like to invite SBP Integrasi Selanda to present.
Ladies and gentlemen, the video that you just witnessed show a glimpse of the inevitable impact of COVID-19 that is happening in Malaysia. As we can see, even though we have the privilege of getting the vaccine, not like some other countries like Africa, there are some people that still neglect the vaccination. The COVID-19 vaccination has always been the controversial issue amongst educators and is affecting our country. These are some healthcare efforts to achieve vaccine equity. Programs like National COVID-19 Immunization Program, COVAX, the COVID-19 Vaccine Delivery Partnership, and awareness raising campaign to promote vaccine in Armenia, Azerbaijan, and the Republic of Moldova. The aim of this program is to serve only one purpose, which is to reach vaccine equity. Before that, Assalamualaikum and greeting I bid to everyone. We are the team representative from Selanda Integrated School of Malacca, and this is our presentation regarding the topic Vaccine Equity, Global Acceptance and Prejudice. One of the key highlights of the presentation is to find out the reason why people object and why they accept the COVID-19 vaccination. Before getting into the whole topic, let me give you a view of what is actually meant by vaccine equity. Vaccine equity means that ensuring everyone in the world have the same access to vaccination. Expert and public health officer has been emphasizing this during the pandemic, but it's also relevant to other illnesses and vaccine as well. Ensuring the safety of school community have been our problem statement because we need to narrow the scope to Malaysia, not the global, because this is our beloved country that we need to focus on. We believe that if all the teachers have been vaccinated and safe from the COVID-19 altogether, it's created a safe place for students and staff to go to. However, from the video we see earlier on, there are still teachers who did not want to take the vaccine. We have chosen Justin, district teacher, as our respondent of our survey. You may ask why. Because first of all, it is important to create a safe environment and convince parents that schools are safe. Second of all, it is easy to get consent from Justin district education office to carry out the survey that we have did because he was our former principal. After doing an in-depth research of the actual topic, we have come up with two objectives. The first one is to find out the reason for acceptance. The second one is to find out the reason for prejudice. Qualitative and quantitative method have become two of methodology that we did. You may ask why? Because qualitative method, we did an interview towards the teacher who did not take the vaccine. The interview was conducted via Google Meet. While the quantitative method, we conducted a survey towards teachers from around Justin via Google Form. First of all, the procedure of carrying out the qualitative and quantitative method. First, we get the consent from the PPD. Second of all, we get the approval from the teacher to be interviewed, and questions from the survey are made based on this framework. The interview and the survey was distributed throughout the month of September, and the information is obtained, and here are the results. This is the framework of hesitancy that we use to carry out the interview and question from our survey. These 6 main factors of individual decision making about vaccination. So we asked, have you been vaccinated? 89% people say yes, while 11% other don't. This has been supported by the statement by Sina Harian, which they said there are 95.7 teachers who have completely taken the COVID-19 vaccine until 31 October 2021. So what are the main reasons for people accepting the COVID-19 vaccine? 38.1% said they took the COVID vaccine because of risk perception and trust. Barry Bloom from Harvard Chan School of Public Health said, the most important ingredient in all vaccine is trust. The second main factor for people accepting the COVID-19 vaccine is because public health policies. Prejudices announced in the news on 3rd September 2021 that teachers who have not been vaccinated against COVID-19 will not be allowed to return school for physical classes. What are the most main reason for people objecting the COVID-19 vaccine is past experience. Our interviewee stated that they expressed concern that the vaccine was not sufficiently tested and the long-term negative physical consequences could not be ruled out. She stated that because she has gone through a moment where she saw her neighbor getting sick and died after getting the vaccination. While Safrina, in her journal that she wrote in 2021, she stated that it identified emotional distress, negative past experience, and misconception that contribute into vaccine hesitancy amongst children and family. How much do you trust the public health agency that recommends you to get the COVID-19? Even though a large number of people, which is 47.6% say they trust them completely, there are still 4.8 people who did not trust. This did not tally up with the first question, have you been vaccinated? 89% people say yes, but why there is still people who did not trust the government completely even though they took the vaccination? Our interviewee said, I don't really trust them because vaccine is not made in a proper way. Because in 2 years, you created a vaccine. She did not trust the government about the safety of the vaccination. Do you trust the government on the COVID-19 vaccine? 85.7% yes, said yes, while 14.3% said no. This also did not tally up with the first question. Why only 85.7% said they trust the government, while 89% of them took the vaccination. And 51.9 said they agree that the vaccine protect you against the virus, while 9.1% say no. Our interview stated that it is because the vaccine is not strong enough to protect us from the COVID itself, because people who already took the vaccine also caught the COVID-19. Do you think the government has done enough to educate people on COVID-19 vaccination? Kondon Shinha 2010 and Sergey Zing 2014 stated that trust has been repeatedly proposed as an important factor contributing to public compliance during a pandemic, and has been reported to influence people's perceived risk of pandemic. And to conclude, authorized person and institution play a vital role in eliminating or at least resisting this hesitation. Second of all, perception about the safety of COVID-19 vaccine and attention to past experience were the main factor that determined the hesitation of COVID-19 vaccine. To summarize, we have been able to give you what global healthcare has done to reach vaccine equity. We have give you the meaning of what vaccine equity is. We have know the reason why people accept the vaccine and why they object. Vaccine hesitancy has always been an ongoing problem, and an understanding about the phenomenon and to conclude, we already reached vaccine equity in Malaysia, but it is up to this small margin of anti-vax to know that by getting the vaccination, there is more benefit than harm. And that is all we have to say in this span of 10 minutes. Thank you all for listening to the end.
Here, I would like to invite the audience to ask questions.
Good morning. I'm Leo from School of Science Banting. I have a question. With Malaysia achieving herd immunity, do you think it is still relevant for the government to ban teachers who are not vaccinated from returning to school?
I think it is because, first of all, thank you for your question. In my opinion, it is yes, because government have made some public health policy, which is the teachers, in order to make school as a safe place for students and also the teachers as well. So the government have made a policy, which is this, the teachers who not completely vaccinated can be at school. So with these policies, the purpose of these policies is to make a school as a safe place for school. So it is for our sake. So yeah, I think it should.
Thank you.
Hi, a very good morning. So I'm from Academy Science Bernard, and just now you guys have provided an in-depth review of this vaccine hesitancy, right? Sorry, vaccine hesitancy. Is it? All right. So now I'm wondering, what if the people even after the government tries to convince them, what if they still don't accept the vaccine? Then how would you suggest the government to protect them?
Okay, that's a good question actually. So thank you for the question. So first of all, in order to make everyone take the vaccine, so first of all, the government should make a smooth strategy. Because of what? Because if government make a law or policies, so it is such a waste, because the law doesn't make the teachers wonderful to follow, make the teachers to follow the rules, because it is their human right either to choose the vaccine or not, because it is human right, right? So I suggest the government, first of all, I suggest the government to show to the public about how vaccine is this made and the efficiency of the vaccine itself. Because according to Dato Zulkarnain, the deputy director of Pharmaniaga Berhad, he said that the process of making vaccine should be transparent to public to reduce the mistrust of the public to the vaccine. And the second one, I think the government should make a smooth campaign to convince them, because it is the step is like more to psychological step, which is we can convince them psychologically. I hope it will answer your question. Thank you.
I see. So at the end of the day, it's still up to the person itself.
Yeah, because the vaccine, because it is the human right, so we can't force force totally. So we only the government can do is we convince them psychologically and with a smooth strategy, and finally with the smooth strategy, the teachers will finally take the vaccine. Thank you.
All right, thank you.
Next, I would like to invite the judges to ask questions.
Thank you for your presentation. I appreciate that you've narrowed your study to the educators in Jasin district. My question would be, in the global perspective, whether did your team did some research or look at the background on similar issues happening around the globe or in other countries with regards to educators? And if you did, maybe you can share with us.
Oh yeah, and also we look at the others journal from the China, from the Turkey as well. Among the vaccine hesitancy among the teachers and educators, then we look at the journal. We found that the educators also there is some hesitancy among the teachers because of these factors that we stated in the framework.
Thank you to SBP Integrasi Selanda for your presentation.
Test. 1, 2, 3. Nice. Yeah. Good.
I, Nordamia Afrina binti Ahmad Zamri from SM Science Hulu Terengganu, will be replacing Nur Ayuni Kistina binti Rosdi as your moderator for today. Now I would like to invite SM Science Selangor to present.
Assalamualaikum warahmatullahi wabarakatuh, and a very good day I bid to the moderators, respected assessors, and audience. I, Akif,
And I, Nick,
from Sekolah Menengah Sains Selangor, will be presenting to all of you the findings from our research on COVID-19 vaccine, skepticism, acceptance, and delivery. Now, let us start by watching the short video.
now, ladies and gentlemen, millions have refused the COVID-19 vaccine due to uncertainty. This stems from heterogeneous factors. However, the fundamental cause to be put under scope is the human capability to adapt to abrupt and critical situations. Statistics brought out by the New York Times clearly show the stark gap between different vaccination programs in different countries, as you can see from the data provided. The darker the shade of green, the higher the vaccination coverage in the country produced, and the warmer the shade of red, less.
The situation worsened as the numbers of anti-vaxxers increase and continues to plague the world. As we have come to an endemic phase with restrictions being lifted and everything reverting to how it was, the number of COVID-19 cases remains consistent. Vaccines have been rolled out. However, there are skeptics who manage to influence groups of people to not get the vaccine. The question is, can we manage to curb the venomous spread of COVID-19 with the presence of those who refuse to get the vaccine? What is actually the reason behind the facade of anti-vaxxers in spreading their twisted ideology and created skepticism in the minds of many?
This is where our study will undoubtedly prove to you the skepticism surrounding the COVID-19 vaccines and ways to solve issues regarding vaccine acceptance, especially now that we've come to an endemic phase.
In 2021, according to the World Health Organization website, WHO has set the target for 70% global vaccination coverage by mid-2022. However, as of June 2022, only 58 of WHO's 194 member states had reached the 70% target. What happened to the other 136 member states?
Well, according to Jeffrey Lazarus and his fellow researchers, vaccine hesitancy is defined by the World Health Organization Strategic Advisory Group for Emergencies as the delay in acceptance or refusal of vaccination despite the availability of vaccination services. The authors of this study reported low COVID-19 vaccine acceptance among more than 13,000 respondents in 19 of the world's hardest hit countries at that time. As of 14th December 2021, nearly 1 billion individuals were partially vaccinated against COVID-19, and another 3.64 billion were fully vaccinated as of late. However, more than 44% of the world, predominantly in low and middle income countries, were still unvaccinated, and case rates, hospitalization, mortality rates remain high globally.
A study by Sun Kyung Lee's team in 2022 examined various types of misinformations related to the COVID-19 vaccines and their relationships to behavior, to vaccine hesitancy and refusal. The first study asked a sample of 505 full-time working professionals in the United States about possible misinformations that were exposed to related to COVID-19 vaccines. The second utilized an online survey to examine 441 United States college students' knowledge about possible misinformations that were exposed to related to the COVID-19 vaccines. The analysis of open-ended responses in the first study revealed that 57.6% reported being exposed to conspiratorial misinformations such as COVID-19 being harmful and dangerous. Findings across these studies suggest that exposure to misinformations and believing it as true could increase vaccine hesitancy and reduce the behavioral intention to get the COVID-19 vaccine.
Another web-based survey by Ahmad Azati Mohammed, which aimed to determine the knowledge, perception, and acceptance of Malaysian adults regarding the COVID-19 vaccine, finds that 62% out of 1,406 individuals who had poor knowledge about the vaccine. Those who have high knowledge scores regarding the COVID-19 vaccines are those who have high education background, higher income category, and are living with those who are at risk of getting severe COVID-19 symptoms. They were the ones who were most willing to get vaccinated.
Other than that, an article by Alison Shepard for the British Medical Journal on 5th January 2022 revealed that up to 1 million COVID vaccines are estimated to have been expired in Nigeria, where less than 4% of the population has been vaccinated. According to the World Health Organization, the lack of infrastructure in delivering the vaccines is one of Africa's most pressing problems. Only 17.5% of Nigeria's population has been fully vaccinated as of late, which is under 20%. Does this sound acceptable? This highlights the current inefficient distribution method used by several countries. But fear not, as we have ways to solve not only the challenges brought by delivering the vaccines, but also to eradicate the stigma surrounding the COVID-19 vaccine and encourage widespread vaccine acceptance.
Now, to the solutions that we have come up with. Firstly, to address the issue of vaccine skepticism is to promote the idea that vaccines can help protect their health. This means that the lethal COVID-19 vaccine can be simply avoided or tamed by taking the vaccine. And even if you were to get the virus, you would be less likely to suffer severe COVID-19 symptoms, which could lead to fatality. This can be done by using social media with the collaboration of stakeholders from the government, vaccine manufacturers, and researchers to ensure that the public gets the correct information that the vaccines will not harm but help.
Next, to increase vaccine acceptance, we need to increase vaccine knowledge and overcome misinformation regarding the COVID-19 vaccine. This misinformation happens because they believe that the invention and approval of the vaccine was rushed with underreported side effects. So, this can be addressed by local leaders proactively reaching out and educating skeptics via the mass media. For our country, we have seen our leaders, like our Prime Minister, broadcasting it to the whole nation through the news channels that they themselves took the vaccine and proving it to society that it is indeed safe. This empowers the society to make personal decisions without pressure. As individuals, we can also play a part by spreading the advantages of taking the vaccines against not taking it. This can also be done by using social media platforms. If we can't reach out to the whole world, we can at least reach out to those near us.
Finally, to address the issue of vaccine distribution, the concept of multi-stop charter flights, which was first piloted by UNICEF in June 2020, can be utilized. Under this approach, several vaccine shipments are pulled into a single aircraft, making stops in several countries. This innovative freight solution substantially decreases the cost of delivery for each country, while supporting access to vaccination to locations that would be otherwise hard to reach due to the lack of commercial freight options.
So, ladies and gentlemen, we can conclude that vaccine skepticism, acceptance, and delivery are issues that can be solved, and the government should take these obstacles as a medium to improve their service and management, and in this case, sorting out the COVID-19 vaccines and persuading skeptics in order to reach the vaccination target soon.
We hope that our presentation is able to help educate and spread awareness of the truth so that we can finally reach the WHO standard and gain herd immunity against COVID. Thank you for listening. We are now open to questions.
Moving on, I would like to invite participants to ask questions.
All right. Good afternoon. So just now you have mentioned that one of the ways to combat vaccine hesitancy um, is to combat misinformation. However, these methods had been long existed. There are many fact checkers, there are many news in the media that is used to combat misinformation in our society. But as we can see today, anti-vaxxers are still anti-vaxxers. They still hesitate to take the jab and to get vaccinated. And we cannot say that these anti-vaxxers are from uneducated groups, since most of the anti-vaxxers are actually do receive education in university or college. So I would like to ask for alternative or recommendations to the problem. Thank you.
Okay, thank you for the question. He asked about other ways to increase, to persuade the skeptics or to educate the skeptics about the vaccines. So I think the va- the reason is that they are still anti-vaxxers, or that they still don't have enough informations or knowledge about the vaccine, or because they receive misinformations, like I said before. So even if they are educated people, when they receive the informations, they will believe it and become anti-vaxxers. So hope that answers your question.
Um, as for ways to solve the question you just posed, we have come to an idea where we will promote the idea that they will protect their health or their loved ones. So in the end, even grandmas who are against taking vaccines will take the vaccine because they worry for their grandchildren. Thank you.
All right, good afternoon. So I'm from Academic Science Pandang. Earlier, as part of your solution, you guys mentioned something about multi-stop chartered flights, right? And one point you pointed out is that it can deliver vaccines to rural areas. But the thing is, what if airports are not available in those rural areas? Could you suggest ways of delivering vaccines to these rural areas while being cost effective so that poor countries can afford it? Thank you.
We have seen various governments using the vaccine shipments through the aircraft to airdrop vaccine shipments on the said location to reach islands or settlements which are isolated from certain countries and governments. This means that everyone can have access to the vaccines, and onboard help could also drop off on the location. Thank you.
All right, thank you.
Now I would like to invite judges to ask questions.
Assalamualaikum, and thank you so much for your presentation. I'm curious to learn more on how did you go about your thought process in conducting the study. I mean, with regards to this very specific topic.
Okay, so we use synthesis metrics for all the peer journals. So we collected all the journals and compare it, and we'll pick whichever one which is suitable for our research. For example, the British Medical Journal and PLOS ONE.
Thank you. Thank you for the informative presentation from SM Science Selangor. This session will for 5 minutes for tech questions.
Testing 1, 2, 3.
Testing mic 1, 2, 3. Testing mic 1, 2, 3. Testing mic 2, 3. Testing mic 2, 3. Am I audible? Testing mic 1, 2, 3. Testing mic 1, 2, 3.
Now, I would like to invite SM Science Kuching Utara to present. The stage is yours.
During the unprecedented pandemic, we believe that the corner of creating a perfect society lies within vaccine equity, where there's a fair distribution and vaccines will become accessible to everyone across the globe, nevertheless who they are, where do they come from, and even their socio-economic background. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good day I bid to the eye-catching chairperson, wise panels of educators, precise timekeepers, and of course, not to forget, members of this August 4. We're the representative from Sekolah Menengah Sains Kuching Utara, and today we're going to give you a detailed presentation how vaccine equity could be the catalyst of a foundation of a society that caters towards the people's needs.
First and foremost, before we start off our presentation, we would like to introduce the members of our group. Firstly, we have Marisa, my co-presenter. Secondly, we have me, Adib.
And not to forget our two diligent technical assistants over there, Hazim and Jihad. Today, Our presentations consist of 5 parts. We're going to start off with introducing our objectives, followed by our findings, which is causes, problems, and solutions. We're going to conclude everything that we have said today in our conclusion segment. Moving on. We've conducted our research through library research by surfing through some notable websites such as the World Health Organization, WHO, the New England Journal of Medicine, and even Ministry of Health COVID Now. From that, we have concluded 3 main objectives. Our end goal for this presentation is very simple. Number 1 is to identify problems regarding on vaccine inequality. Number 2 is to figure out initiative to solve human rights issue. And last but not least, but to spread awareness on the importance of equal access to vaccine for global health security. Now, I am going to introduce to you to 5 pillars of causes that will lead to bigger problems. But fear not, for these problems we have their very own solutions. To start off with, we have global shortage, where higher income countries, also known as HIC, across Europe and North America have hoarded up many of these extra doses of vaccines. These actions leads to a consequences where they have tied up the global market. Secondly, there's weak leadership engagement and commitment, where leaders of third world countries mostly have failed to initiate diplomatic relationship with other nations that could have been the saver of their people's life. Ladies and gentlemen, we're going to emphasize really hard on all of you that leaders plays a huge and critical role in this scenario, as they're the one who should have been advocating and engaging within the community. Leaders also have the power to hold a nation accountable and even allocate a special budget for policy supplies. Here comes point number 3, which is lack of transparency in vaccine contract, where again higher income country HIC have failed to present us data and information regarding on the vaccines control supply that is happening in their own country, such as the vaccines delivery date, volume, and even the pricing. This happens due to the unequal vaccine distribution. Coming up point number 4, which is high demand and low supply, which, to put it in simpler words, right now in the status quo, we're facing a scenario of insufficient supplies of vaccines. But despite to that fact, higher income countries such as Canada, US, and even UK still have a high accelerating number of vaccination rate. But this leads to the rest part of the world, such as India and Bangladesh, are still struggling even to gain access to vaccines against the COVID-19. And last but not least is the absence of limitations towards the purchases of vaccines. Ladies and gentlemen, this leads us to 2 levels of analysis. First off is vaccine hoarding. Secondly, this incentivizes the competition between HIC, higher income country, and LIC, lower income country. This is the one that's going to prevent us from having a prompt and equitable dose sharing. Third world country need all of these extra doses as soon as possible, not the leftovers that will come many months from now on. For the next part, I'm going to hand it over to my friend over here, Adib. Please welcome.
A quick thank you to my co-presenter earlier. Forging on, these actions do come with significant consequences, such as the rise of new problems and the reinforcement of pre-existing ones. Starting off with the most important factor of all, which is finance, relating to my first main point, and that is drastic decrease in gross domestic product, also known as GDP. Due to the rise of new necessities becoming the norm during the pandemic, our public spending has ceased to grow exponentially, while the access to finance is constrained due to it being diverted to its competition for the limited amount of vaccines in the market. Now, secondly, we have vaccine nationalism, an unethical philosophy constructed by the higher income countries to justify their false prioritization of their citizens' lives over others' lives. Thirdly, we have ensuring equitable focus. In this context, we need to ensure that focus isn't diverted towards COVID-19 at the expense of other areas of the healthcare system. This is because ever since the rise of the pandemic, our pre-existing healthcare system has been getting worse and worse day by day, especially in developing countries. Fourth of all, we have delay of distributions. Due to the delay of distributions, the virus has been given the time to roam free longer than it ever should. This induces the rise of new variants such as the Omicron variant and also the Delta variant. Lastly, we have the fading hope for the attainment of global unity. This stems from the prejudice conducted against high-income countries, showing their true colors and prioritizing themselves. Not only that, we also get to see the true colors of major initiators, primarily COVAX, showing hypocritical actions, which ultimately led them to their great failure. Now, moving on to the next part of our presentation, we have solutions. With such problems comes the search for solutions. But since the damage had already been done this time to this generation, it falls onto us, the upcoming stakeholders of the upcoming era, to find solutions to prevent it from ever happening again. First, incoherence between domestic and international policies. This is to avoid the rise of false concepts such as vaccine diplomacy, where higher income countries are forming contracts with vaccine suppliers in order to monopolize the vaccine market, and also vaccine nationalism, which I have previously stated. Secondly, we have reaching a global consensus on principles, or in other terms, getting our priorities straight. This is to avoid the unnecessary deaths of innocent lives and the repetition of previous mistakes. For example, we believe that research focus should be diverted towards the youth and children instead of adults, as the youth and children makes up half the population of developing countries. Now, number three, we have COVAX, an initiative constructed by the WHO with the sole purpose of equitably distributing vaccines all over the world, or in a more general way to explain it, supporting good intention initiatives. Though, if there's one thing that we could learn from previous events, is that we need to thoroughly assess these initiatives and their principles before fulfilling their requirements. Fourth of all, we have international effort. All these solutions could have been done with ease had the key decision makers, such as the UN, G7, and G20, decided to use their huge international influence and wealth, which could have supported many more countries, especially developing countries, all at once in order to aid the financial battle of the crisis. Now, this heavily relates to my last point, and that is strong global leadership engagement and commitment. First, let me just reiterate how important these key decision makers are to the world. Each good decision they make could literally change the world for the better. On the other hand, each bad decision they make, they don't know who's going to die, whose lives will be shattered, whose bloodline will end. Yet even then, it seems like they still chose to prioritize themselves at the expense of others. Moving on to the last part of our presentation, we have conclusion. To conclude the context of our presentation, we, as the students of Sakura, believe that we need to execute these urgent actions in order to achieve the global utopia that we have severely dreamt of. Firstly, we need to act in solidarity and fairness, especially in vaccine distributions. Secondly, we need to be accountable for our own actions. Thirdly, we need to be ready for the unprecedented problems in the years to come. Lastly, we need to be transparent, especially in social contracts.
We have come from a very long way from pandemic to endemic. Now, ladies and gentlemen, let me ask you just very few questions. What will happen if there's a second pandemic? How would we react if there's another deadly virus threat? And how would we ensure global leaders would work together as a team in order to overcome the disparity of vaccine inequity?
Only by working together can we bring this pandemic to an end. That's all from us, the students of Sakura.
We're now ready for your questions.
Thank you.
Moving on, I would like to invite audience to ask questions.
All right. A very good afternoon. So I'm from Academic Science Penang. Well, earlier you guys mentioned about the need for coherence between international and also domestic laws, regulations, right? So yeah, now there's an issue with these regulations. That is, how are you going to enforce them when they are like these huge nations such as the United States itself hoarding so many vaccine doses? How are you going to convince them when they are so powerful? Thank you.
All right, thank you so much, sir, for that question. Ladies and gentlemen, one thing to be clear is that We are living in a harsh truth of a capitalistic society where the rich would get richer and the poor gets poorer. But because of that, luckily we have initiatives such as COVAX that is to ensure that every nation would have equitable access to vaccines despite of the economic background that the countries have. I hope that answers your question, sir. All right, thank you so much.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Again, representative from Bataraki Integrated Boarding School. Again, great presentation. I love it. One question though about the right now we can see the problem with the vaccination rates are among third world countries or poorer countries, and these countries do have a history of sometimes corrupt leadership or even leadership that isn't able to control the country properly. We've seen, for example, the Taliban taking over that country itself. And with that in mind, how are we going to establish the coherence, the international coherence between these unstable countries and those advanced countries? Thank you.
First of all, thank you for your question. Based on our literature review, we believe that appointing a global leader or making these initiatives such as the initiatives like COVAX consulted by the WHO will surely ensure coherence between these domestic countries in this harsh world that we're living in. With the presence of global leadership, we can enforce them each and every country in the world to follow by one rule and one rule only. I hope that answers your question.
Now, I would like to invite judges to ask questions.
Thank you so much for your presentation. I've indeed learned a lot. My question would be, on a practical basis, how would you empower youth or children or your peers on appointing suitable global leaders, at the ground level here? Thank you.
Thank you so much, ma'am, for that question. Now, ladies and gentlemen, that's why education plays a huge role while building a characteristics of students. That's why, in order when we have a proper education, especially in Malaysia, we can have great youth leaders such as Syed Sadiq that empowers youth. Ladies and gentlemen, all of us here are future leaders, and right now, that's why one of the initiatives that government has created, such as this kind of program where we could voice our opinion, we throw out our ideas so that we ensure there will be leaders that can empower youth at the end of the day, so that we could tackle problems such as vaccine equity that could that is when we're talking about significant things such as human rights issue. I hope that answers the questions, ma'am.
Thank you for the informative presentation from SM Science Kuching Utara. Thank you to all judges for your time. Then I guess this is the end of our session for today. Thank you.